Hey everyone, and welcome to our deep dive today into
Yeah.
AI and healthcare.
It's going to be a fun one.
I know you guys are really interested in this topic, so let's just jump right in,
I think it's a really hot topic right now for good reason.
for sure.
Really interesting stuff.
We've got a few sources lined up here
Yeah.
to guide our deep dive.
Okay.
We are going to be using an overview of AI applications in healthcare from Coursera.
Sounds good.
Also, the Cleveland Clinic has a great piece on how they're currently using AI in their own facility.
Nice.
And then lastly, a report from the USGAO that really takes a deep dive into the benefits and challenges
Okay, so kind of a
of AI in healthcare.
balanced perspective.
Exactly.
Nice.
So first things first,
Nice.
what exactly are we talking about when we say AI in healthcare?
Yeah, that's kind of a nebulous term.
Right. It
Yeah.
sounds very futuristic,
It does.
but it's actually happening right now.
Absolutely. So at its core,
Yeah.
AI in healthcare is using computers to simulate human intelligence and perform really complex tasks.
Oh, wow. Okay.
So it's not about replacing doctors,
Gotcha.
but it's giving them new tools to work with.
I see. So it's like giving them like a super smart assistant that can like
Yeah.
look at all this data,
Analyze data.
make better decisions and things like that.
Exactly. And think about it this way.
Okay.
Imagine a doctor in the 1800s looking at, a black and white photo, and then now a doctor looking at like an image from an iPhone 14 Pro.
Oh, wow.
That's kind of what AI is doing for diagnostics.
Okay.
It's giving them that level of detail and insight that was never possible before.
I see.
Oh.
That's a great way to put it.
Yeah.
I remember in that Cleveland Clinic article they were talking about
Yeah.
how AI is being used to look at mammograms
Yes.
and help radiologists see
Subtle changes.
even the tiniest little changes.
Exactly.
That could be an indication of cancer.
Which would be very hard for a human to see.
Yeah.
But the AI is flagging these things.
Wow. So it's really becoming like a second pair of eyes.
Exactly.
It's a second reader.
A second reader. And I imagine that also like speeds up the process.
Absolutely. So it can improve accuracy, but then also speed,
Which can be life-saving.
which is life-saving in an emergency situation.
Right.
Absolutely.
And speaking of speed, I know the Cleveland Clinic was also talking about using it
Yeah.
to triage stroke patients.
Uh-huh.
And so like the second that like the scan picks up something,
Immediately, it's sent to the entire medical team.
wow.
So everyone is alerted,
So you're saving like minutes.
saving minutes, which in a stroke situation
It's so important.
is critical.
Yeah, time is brain, they say.
Time is brain.
That's right.
Right.
So we've talked a lot about the diagnostics part of it, but it's also having like a big impact on medical research.
Absolutely. Yeah.
Yeah.
I think one of the most exciting areas is the use of AI to analyze massive data sets to identify biomarkers.
And then predict outcomes. And this is particularly promising in things like epilepsy treatment,
Yeah.
where we need to understand brain activity
Right.
and all those subtle patterns.
Yeah, the Coursera overview actually gave a really cool example
Yeah.
of that they were talking about this epilepsy specialist, Dr. Jehu.
Okay.
And she's using AI to get a deeper understanding of her patient's data.
Interesting.
And she can see things and make connections that a human just couldn't.
Yeah, because it's pulling from so many different sources.
Right.
Right. So you get the whole picture
Yeah.
with the help of AI.
Wow. So AI is really allowing doctors to like personalize treatment plans
Absolutely.
in ways that we never could have imagined before.
Yeah, and it's shifting the paradigm from reactive care to proactive intervention.
Oh, like that.
Yeah, so we can identify potential problems early on and then tailor treatments more effectively.
Right.
And even prevent certain conditions from developing.
So it's almost like preventative
Preventative, yeah.
medicine in a way.
Absolutely, yeah.
Wow.
It's very exciting.
That's super cool.
Yeah.
And this ability to like analyze massive data sets and extract these meaningful insights.
Yeah,
It's not just for diagnostics and research.
it's not.
It's also changing how patients are interacting with the healthcare system. Directly, like through those AI chatbots
Exactly.
that we see everywhere.
Exactly.
Like on every website now.
Well, they're becoming more sophisticated too.
Are they?
Yeah, and they're able to handle more complex queries.
Really?
Even provide personalized health recommendations.
Oh, wow.
And they can improve access to care,
Right?
especially for people in remote areas
Yeah.
or those with limited mobility.
That's amazing. And then there's also that ambient listening AI that they were talking about in the Cleveland Clinic piece,
Oh, yeah.
which I thought was super cool.
That was wild.
That an AI can actually sit in on appointments and take notes for the doctor.
Exactly. That one freaks people out a little bit,
Yeah.
but it's already happening. Yeah, and the idea is to free up doctors from the burden of documentation so they
Right.
can focus more on their patients.
That makes a lot of sense.
Yeah.
So it's like having a little personal scribe with you.
Exactly.
Huh.
And I think that's something patients really appreciate.
I bet
Yeah.
that the doctor can actually like focus on them and listen to them.
Eye contact. Yeah.
Yeah, and not be like writing stuff down the whole time.
Yeah, exactly.
Okay, so we've seen how it's being applied in a lot of different ways.
Yes.
What makes it so promising?
Yeah.
Like, what are the big benefits here?
One of the biggest benefits is efficiency.
Okay.
AI has the potential to automate a wide range of tasks,
Okay.
from scheduling appointments to analyzing lab results.
Right.
So it frees up providers to do more complex and demanding
Right.
aspects of patient care.
It's not about replacing people. It's about letting them work
Exactly.
more effectively.
Smarter, not harder.
Smarter, not hard.
Right.
Yes, exactly.
Yeah.
So,
And so that can also lead to lower costs. Oh, okay.
if we streamline processes and reduce the administrative burden,
Makes sense.
yeah,
And of course, we always want to improve patient outcomes.
absolutely.
At the end of the day, that's the goal.
Exactly.
Yeah.
And AI has the potential to do that.
Okay.
Faster and more accurate diagnoses lead to more effective treatments.
Uh,
Personalized treatment plans
right.
mean better outcomes for individual patients.
That makes sense.
And the AI can analyze massive data sets and help us identify new treatments and cures
Oh, wow.
for diseases that have plagued humanity for centuries.
So it's almost like we're getting like a new lens
Yes,
to see the human body
I like that analogy.
and how it works.
Yeah, we're seeing patterns and connections that we never even knew existed before.
Yeah. And the market seems to agree with all of this.
Absolutely.
I know the Coursera piece was saying that the market is going to reach like $188 billion by 2030.
Billion.
That's huge.
That's a big number.
That's a lot of money being invested.
Yeah, that tells you something right there. Yeah, they're seeing the potential.
Absolutely.
But it's not all sunshine and roses, right?
It's not.
There are some challenges as well.
Every new technology has its challenges.
Right.
Absolutely.
What are some of the things that we need to keep in mind?
Yeah, and that's where I think the GAO report is so valuable.
Okay.
They really took a deep dive into the potential downsides,
Okay.
and they highlighted some key areas of concern.
Like what?
One of the things they talked about was the challenge of data access.
Data access.
Yeah,
So even though we have all this data,
we have more data than ever.
it's not necessarily easy to use.
It's siloed.
Oh.
It's hard to get to.
Okay.
And AI algorithms are only as good as the data they're trained on.
Right. Garbage in, garbage out.
Exactly.
So if we want to have effective tools,
We need good data.
we need the data.
Yeah.
And what do they recommend for that?
So they actually recommend creating a data commons,
A data commons.
which would be a giant shared pool of data that developers could access. Oh, wow. So everybody could just
Yeah, contribute to this pool.
contribute to it, and then everybody could use it.
Exactly.
So it would really accelerate the development of these
absolutely.
pools.
It would help.
I like that idea.
Yeah, I think it's a really intriguing concept.
And it really highlights the need for collaboration.
Huge.
Right.
Like researchers and healthcare providers and tech companies and policymakers
All working together.
all working together.
Yeah, because none of them can solve these problems on their own.
No, it's too big.
Right?
Way too big.
And at the end of the day, it's really about people.
It is.
It's about improving patient care and making things better for everyone.
And creating a more equitable and effective healthcare system.
Right.
Yeah,
Absolutely.
for everyone.
It's not just about the technology.
That's right.
It's about how we use it
Exactly.
and how it impacts people.
And are we using it ethically and responsibly?
Right.
Yeah.
That's a really good point.
Yeah.
Well said.
Okay.
Okay, so we take a breath.
Yes. We just covered a lot of ground.
You know, it's interesting.
Yeah.
We always hear these concerns about AI replacing human jobs.
Right.
But I almost think in healthcare, it's like
Uh-huh.
augmenting human capabilities and creating new roles.
That's a really good point. I think the Cleveland Clinic article even touched on that
Yeah, they talked about
a little bit.
the demand for people who can bridge that gap between medicine and technology.
Oh, that's so interesting.
Yeah.
Yeah.
We need people who can develop AI algorithms interpret the results,
Right.
integrate them into clinical workflows.
Like a whole
new roles
Right.
that didn't exist a few years ago.
Wow.
And the demand's just going to keep going up.
Yeah. It's really changing what it means to be a healthcare professional.
It is.
Yeah. It's not just about medical knowledge anymore. It's like
Yeah, you got to be techie too.
you got to have the tech skills.
Yeah, absolutely.
So data access, we talked about that collaboration. What other challenges did the GAO report highlight?
One of the issues they raised was a lack of transparency
Okay.
in some of these AI systems. So
It's hard to understand how they reach their conclusions.
the AI says this patient has this condition,
Right.
but we don't really know why.
Right.
And so how can doctors trust that?
Exactly. And that lack of trust
Yeah.
can be a major barrier to adoption.
I bet.
And so the GAO really stressed the importance of clear explanations
Okay.
and thorough evaluations of these systems
Yeah.
to build confidence.
So doctors can feel like, okay, I understand how you got to this conclusion.
Exactly.
I agree with it.
I can trust this recommendation.
Versus just blindly following what the AI says.
Exactly. You don't want to blindly follow anything.
Right. You got to be able to critically think about it.
Think for yourself.
Yes. And then that brings up the whole question of liability.
Ooh.
Who's responsible when an AI tool makes a mistake
Good question.
that harms a patient?
Is it the developer?
The hospital, the doctor?
It's like a big gray area.
It's a legal gray area.
Yeah,
And that uncertainty can make people hesitant to adopt it.
sure.
Even if it could improve care.
Because who wants to be held liable if something goes wrong?
Exactly. Nobody wants to be on the hook for that.
Right.
And so these legal and ethical frameworks for AI,
Yeah, we need to work those out.
we need to figure that out
Yeah.
as AI becomes more sophisticated and more integrated.
Yeah.
These issues are just going to become more complex.
It's not just about developing the technology, it's
So
about
it's about the guidelines and policies.
the whole framework around it.
Exactly.
And like you said, it really requires all these stakeholders.
All the stakeholders, doctors, patients, ethicists, lawyers,
Wow.
policymakers.
That's a lot of people.
a lot of people at the table.
So let's step back for a second and look at the big picture.
Okay.
What do you think the future holds
What's going to happen?
for AI in healthcare?
Well, if those market projections are any indication,
Yeah.
AI is going to be a big deal.
188 billion.
That's a lot of billions.
That's a lot of billions.
Yeah, and the Cleveland Clinic talked about all the new jobs
Right.
related to AI and healthcare.
That are popping up.
They're being created. Yeah,
So it's definitely a growing field.
it is.
And what's so cool is the potential
Yeah.
for AI to solve these medical mysteries
Things we've never been able to figure out before.
that have plagued humanity for centuries.
Yeah, like personalized cancer treatments,
Oh, wow.
early detection of Alzheimer's,
Wow.
maybe even reversing aging.
Now we're getting into sci-fi territory.
I know, right?
That's pretty wild.
It's exciting and a little scary.
Yeah, it is a little intimidating,
It is.
but it's also really exciting to think about.
It is, and that's why we need to have these conversations.
Right.
We need to think carefully about how we develop and use this technology.
Because it's not just some abstract concept.
It's not.
This is impacting real people.
It's going to affect all of us.
Our health, our well-being,
Our future.
our future. Wow. So everyone needs to be part of this conversation.
Absolutely.
Okay, so we've covered a lot of ground today. We talked about how AI is being applied, benefits, challenges, future possibilities. What would you say is the most important takeaway?
For our listener.
Yeah, for our listeners.
I think the key takeaway is that AI in healthcare is not a simple issue.
Okay.
It's complicated.
Okay.
It's nuanced. It requires us to think carefully.
Okay.
There are amazing opportunities,
Uh-huh.
but there are also potential problems.
So it's not about being for or against AI.
It's about being informed.
It's about being informed and engaged.
And engaged, asking questions.
Yes.
Understanding the implications and being part of the conversation.
I like that.
Yeah.
About how we want AI to shape the future of healthcare.
Exactly, and that's where the listener comes in.
Okay.
The more informed and engaged the public is,
Yeah.
the better we're going to be able to navigate this.
We need a society-wide AI literacy boost.
We do!
Yeah.
Because ultimately, these are decisions that are going to affect us all.
Right.
We can't just leave it up to the tech companies and the policymakers.
Yeah, we need everybody at the table.
We need everybody at the table. We need patients, doctors, ethicists, everyday citizens.
And it starts with awareness.
Absolutely. Knowing what AI can do.
Yeah.
Understanding the benefits and the risks.
Right.
asking tough questions, demanding transparency.
Because it's here.
It's here.
AI is already here.
It's happening.
And it's going to impact our lives.
In a big way.
Yeah,
This is exciting and a little daunting,
it is.
right?
But I'm hopeful.
I
think if we approach this with like a healthy mix of enthusiasm and critical thinking,
I like that.
we can really make this work for everyone.
A healthy mix of enthusiasm and critical thinking.
Yeah.
That's a good way to put it.
Okay, so as our listeners continue to learn about this,
Yeah.
keep that in mind.
Stay curious, stay informed, keep asking questions.
Stay curious.
Because your health and the future of healthcare might depend on it.
Well said. Thanks for joining us on this deep dive.
It was fun.
Until next time, stay curious. Wow, that was a lot to cover.
That was so hot.
But it was so interesting.
Really fascinating.
As we wrap this up,
Yeah.
is there anything that like really struck you? What really got you thinking?
What I think is really interesting is how AI is changing the doctor-patient relationship. You know, we talked about AI helping with diagnosis,
Right.
but it's more than that.
Okay.
It's really shifting from a model where the doctor has all the knowledge
Uh-huh.
to one where AI provides more insights.
Oh,
So it empowers both the doctor and the patient.
I like that.
Yeah.
That's a good point. I hadn't really thought about it like that.
Yeah.
It's almost like democratizing medical knowledge in a way.
It is.
Yeah.
And so that raises questions about, how that knowledge is used,
Right.
who have access to it,
Right.
how does it influence decision making.
That's a lot to unpack.
It is.
Yeah.
It's a lot.
The more we learn, the more questions we have.
That's the beauty of this field.
Yeah.
It's constantly evolving.
Yeah.
It's challenging our assumptions about what's possible.
And speaking of possibilities,
Yeah.
like I can't get over that $188 billion market projection.
That's a big number.
Like that's huge.
It really shows the confidence that investors have
Yeah.
in this technology.
But it also raises questions about,
Who benefits?
who benefits from this?
Exactly.
Right, and how do we make sure those benefits are distributed equitably?
Good question.
Yeah.
How do we make sure this serves the needs of all patients,
Yeah.
not just a select few?
Yeah. How do we make sure it's fair for everyone
That's the big question.
Yeah.
That's what we need to figure out
as a society?
as a society. Yeah.
So as we leave our listeners with some food for thought,
Yeah.
what would you say is like the single most important thing they should take away from this?
Stay curious.
Okay.
Stay informed.
Stay curious. Stay informed.
Like,
I like that.
AI is changing so quickly.
Yeah.
What we know today might be outdated tomorrow.
It's true.
So keep learning.
Keep learning.
Engage in thoughtful discussions.
So read articles, listen to podcasts like this one,
There you go.
talk to your doctor,
Yeah.
ask questions.
We'll ask a lot of questions.
Don't be afraid to challenge assumptions
Yeah.
because like you said, the future is being shaped right now.
It is.
We all have a role to play in
You
this.
do.
Yeah.
And we need to make sure that AI is used responsibly and ethically
For everyone.
for everyone
Yeah.
to benefit all of us.
Well said.
Thanks for having me.
Thanks for joining us on this deep dive into AI and healthcare.
My pleasure.
Until next time, stay curious.